Yeah, Joel asked us to record it.
Okay, it's recording. Go ahead and start.
Is opposition fine with that? Okay.
All right. Let's do this again. Today, we strongly affirm the resolution that the United States federal government should enact a single-payer healthcare system. Before I go into our case, let's go over some top-level framing and definitions for this debate. This is a policy round, and should we wait on net benefits? Whichever team provides the greatest amount of good for the greatest amount of people should win today's debates. On definitions, a single-payer healthcare system is a system in which a single public agency, in this case the government, organizes healthcare financing. However, the delivery of care remains largely in private hands. So that's doctors and hospitals. On to some background information. First of all, we see that the Medicare for All Act replaces other insurance, this is private employer Medicaid, with a national government healthcare plan. And it does a couple of things. First, it expands current Medicare to everyone in the United States. Second, it pays for every medically necessary service. This includes preventative care, dental, vision, drugs, etc. Third, there's no copays or deductibles except for prescription drugs, and that's only $200 a year. And fourth, the government is able to set payment rates for drug services and medical equipment through negotiation with those industries. Therefore, our plan is that the United States federal government should pass the Medicare for All Act as soon as possible through normal ways and means. Once again, the United States federal government should pass the Medicare for All Act as soon as possible through normal ways and means. Under solvency, you can cross-apply the explanation we gave in the background information for what the Medicare for All Act does. It is a system of single-payer healthcare that Congress is considering. Second, we see that the processes inherent within switching over to a single-payer healthcare system will save money, because switching over to this new system would eliminate hundreds of millions, if not billions of dollars in administrative fees, pharmaceutical pricing, fee structures for service providers, and eliminating unnecessary or inefficiently delivered services. In fact, the people who wrote the bill noted that the net additional first-year costs of this plan after existing funding and efficiency savings would be $1.25 trillion. Once again, that's $1.25 trillion, but note that the current federal spending on healthcare is $1.45 trillion. So we actually save money. Let's go on to our first advantage, and this is going to be about healthcare coverage. So the thesis of this argument is that many people are losing access to healthcare right now. The plan is key to expanding healthcare coverage and giving these services to millions of Americans. So let's go into the specifics here. First of all, what is happening in the status quo? The current state of healthcare is bad. Two things under this. First, healthcare coverage is decreasing. 27.5 million people, and that's 8.5% of the population, have no healthcare insurance. And that's because the cost of healthcare is increasing. In fact, the number of uninsured Americans rose for the first time in a decade by 800,000 people. And this is largely due to federal healthcare coverage due to cuts in the Affordable Care Act and Medicaid. Moreover, yes.
So are you saying that the reason people don't have healthcare in the status quo is because Medicare is not actually giving healthcare to all the people who can't afford it?
No, the argument is that the government is cutting funding to Medicare and these sorts of services that provide it. But more continuing on, 45% of US adults are underinsured, which means that even though they are insured, their healthcare plan still requires them to pay a substantial out-of-pocket fee. Once again, the reason this is happening is because the rising healthcare is becoming more and more inhibitory. 45% of uninsured adults said that they remained uninsured because the cost of coverage was too high. So the logic here is simple. If healthcare is too expensive, they're not going to be able to afford it. They're going to be uninsured. In fact, we see that healthcare insurance costs reach a record high, surpassing $20,000 per year. That's the equivalent of buying a car every single year. Deductibles, which is how much you pay before insurance kicks in, have also increased from $1,400 to $5,000 a year. So it's becoming more and more inhibitory. Something needs to happen to decrease costs. And that's where our plan comes in. Through a single-payer healthcare system, this will decrease cost and increase coverage commensurately. We see that currently the government has their Medicaid and their Medicare system, which provides health insurance for elderly citizens as well as low-income citizens, respectively. And that has been shown to be able to grant affordability to millions of people. So by increasing the coverage and the eligibility for this sort of government single-payer healthcare system, more and more people will be able to afford it. If the government has shown that their Medicare and Medicaid system is working and is affordable, so the single-payer healthcare system would expand coverage to the millions of Americans who we previously mentioned do not have healthcare. Moreover, you can cross-apply our solvency arguments about how this is going to increase the amount of care they have. So the underinsured people are going to have greater coverage for medical necessities like dental, eye, etc. Ultimately, the plan is going to lead to almost universal, not universal coverage of healthcare in the United States, and leads to just better coverage and better healthcare insurance overall. Now, healthcare is good for 3 reasons. First, it prevents healthcare-induced poverty. Uninsured people face much higher medical bills if they seek care because they don't have insurance to back them up there. So in 2017, uninsured adults were over twice as likely as their insured counterparts to have problems paying medical bills, and 2/3 of uninsured were unable to pay their medical bills at all. Now, if you're unable to afford your medical bills, or if you get into an accident and have to pay like thousands of dollars in medical fees, then many of these people are going to fall into poverty because they simply do not have that disposable income to afford these things. But second of all, healthcare is good because it increases access to preventative healthcare and preventative healthcare. And these are things that basically you go to the doctor to get checked up so you don't get the disease in the first place. Many preventative services are 100% covered by insurance, including our plan. So having insurance increases the people seeking preventative care to increases or decreases the chance of people getting sick in the first place. And once again, that saves money by avoiding ER visits, which are often very, very expensive. Moreover, we said that uninsured adults are more than 3 times as likely to have postponed or not get a needed prescription drug due to the cost. So by providing healthcare insurance to all these people, they're able to afford these key things. And 45,000 Americans die each year as a direct result of being uninsured, and uninsured people have a 40% higher risk of death. That's an extension of the logic we provided you earlier about how preventative healthcare is key. So there's a couple impacts here. The first is going to be that of poverty. The plan is going to decrease healthcare-induced poverty, which is key to decreasing suffering and saving lives there. But second of all, we decrease deaths overall by increasing healthcare and ensuring people are safe.
Okay. Oh yeah, so I'll do off-time red map really quick. So I guess I'll do sort of like the overview issue, just like overviewing like what the big like issue in this round is, the counter plan. Then talk about our contention, and if time permits, sort of go into the opposite government case. But I think a lot of the refutations are going to be in explaining my own contentions, right? So it's a lot of it's just a comparative. Okay. I'll start now. Okay, so I think the overview issue for this round sort of is that like the reason the cost of healthcare is increasing is due to the lack of competition created due to employer-sponsored healthcare. We'd say that the reason isn't simply that there's private healthcare and that's causing the healthcare cost to increase. We'd say in a market economy, when you don't have competition, the people who provide healthcare are allowed to increase costs, decrease quality without any real check back. And so we think that the big issue here is employer-sponsored health insurance. So what is our counter plan? Our counter plan is that we abolish the tax incentive for employer-sponsored health insurance, increase funding for Medicare so that we can cover the people who can't afford it, but we don't think it makes sense to provide single-payer healthcare for every single American, right? Okay, let's go into our plan, right?
Can we get a text of that?
I'm gonna be honest, I do not know what a counter plan text is. I am an East Coast debater. We just don't format counter plans like that. So
Okay, could you repeat it and slower?
okay, I paused time. So our counter plan is essentially we abolish the tax incentive for employer-sponsored health insurance. You make sure that Medicare for all covers all the, I mean, not Medicare, Medicare covers all the people it's supposed to, right? So like you said, you're decreasing funding for Medicare, so not all the people who can't afford Medicare get it. We think we should make sure Medicare actually covers the people it's supposed to cover, right? Like we don't think the argument that like Medicare isn't covering enough people is an argument for Medicare for all. That's sort of like the reason of that segment of our counter plan. Okay, is that good? We're good here?
Yeah, move on.
Okay. Right. So our first contention, we solve better than AF advocacy, right? There are a couple of reasons for this, right? So they're basically proposing Medicare for all, right? And in doing so, they're saying there's only basically one consumer, one person deciding what type of healthcare that all Americans buy, who's getting the money, etc. Right? And so in doing so, right, you're already like limiting competition insofar as basically everybody's competing only for one person's interests. And the thing is, yeah, on the short term, that's great. On the short term, you're saying, look, we are going to just get this one person and then like everybody's competing for them. You're going to get like a good deal. Yeah, great. But in the next 5 to 10 years, what happens? Now that that person has figured out who they're giving funding to, everybody else who's competing basically goes out of business because no one giving them money, right? And so insofar as that is true, once you've decided who to give funding to in the next 5 to 10 years, all the other people competing for funding from the US federal government are going to go out of business because there's no one else buying health insurance from them because everybody's covered under single payer healthcare. So by basically destroying that competition, what you end up doing is on the long term, you've basically made it so you only have a couple of people providing you with healthcare. And in doing that and decreasing the competition to that large of an extent, you end up with the same problem we have in the status quo, in which there's not enough competition for providing good, cheap healthcare. And insofar as that is true, what ends up happening is you don't get good, cheap healthcare because you only have 1 or 2 choices and they're just going to give you bad, expensive healthcare. Why do we uniquely solve for this issue? So first of all, by removing the tax incentive for employer-sponsored healthcare, you basically make employer-sponsored health insurance a thing of the past. Why is this true? This is true for a couple of reasons, but basically, the reason companies choose to give employer-sponsored health insurance is mainly because, right, it's a tax write-off, right? And so essentially what they can do is they can say, look, we're paying you $200,000 in income and health insurance and your total benefits and your salary. But let's say for the 40,000, I don't know the numbers they spend on health insurance. Let's say for whatever amount they spend on health insurance, they get a tax write-off on that. So they're only paying, let's say $180,000, like actually, right? Because they're not paying taxes on whatever the amount they spend on employer-sponsored health insurance. And so in doing that, they're able to pay less to tell the person, right, that they're hiring, they're paying more. And so when that is true, what they end up doing is not caring about the quality of the health insurance. Why? Because they're just telling the person they're hiring, look, I'm paying $20,000 for health insurance, therefore I'm giving you 200,000 benefits. Come work for me because I'm giving you a higher wage. But when you make this incentive, when you stop this incentive, right, there's no reason to provide in health insurance instead of a wage, right? And so in doing that, they're probably just going to provide a wage because that's easier and more like accessible to people. I think people would rather have $50,000 to spend on their own than $50,000 of like health insurance that their employer chose for them without them giving like really any consent. And therefore, right, we're going to see that employer-sponsored health insurance becomes a thing of the past. And so in doing so, right, in removing employer-sponsored health insurance, and especially by removing the lack of competition in employer-sponsored health insurance, because now, right, in our world, because there's no tax incentive, the only thing they care about, even if they still have employer-sponsored health insurance, is basically whether that employer-sponsored health insurance is good. What we have is competition for both the cost and quality of that health insurance, right? And so when these health insurance providers now have to compete for individual people buying them, we say they're forced to decrease cost because the average person, even though their salary is freed up a little bit because now they're getting money instead of health insurance, right? Like some amount of money spent on health insurance, right? Has to pay money to get their health insurance. And in doing that, like we know that the average person cannot pay the, what's it called? The inflamed costs, right? That private health insurance has right now, right? And because they can't pay that, and because private health insurance needs to compete for the individual people buying them now, because there is no longer employer-sponsored health insurance basically subsidizing their cost, what's going to end up happening is that they're going to be forced to decrease costs because to remain in business, they need someone buying their health insurance. And the only person buying it now is going to be whatever portion the government spends, right? And like the only other person is the individuals, right, who need to pay out of their pocket. And in doing that, we are forcing health insurance providers to decrease the cost, to stop increasing the cost. And therefore, we get access to decreasing the cost of health insurance. And in the end, the same benefits they have of increasing the amount of people covered, right? Second contention, right? The quality of healthcare improves in our world. And like, I think it's sort of like the warrant is similar, but the impact is different. The warrant being that we're increasing competition between healthcare, mainly because there's no longer employers subsidizing that healthcare who don't care as much, right, about the quality of healthcare. And in doing so, then the incentive of the health insurance providers becomes to provide the best quality of health insurance rather than just like provide some like quantity of health insurance so employers can just write it off in their taxes. And therefore what we get is better quality. What's the comparative, right? The comparative is Medicare for all. In the Medicare for all comparative, right? Like there's basically no way for the government to actually ensure that you get good quality health insurance, just ensure that people get health insurance. And we've seen that in places like Canada and the UK, they have longer wait times, they have less accessibility to like necessary services, and in the end you get lower quality health insurance, but we are still making sure you get higher quality health insurance, right? And now I'm sort of go into refutation by sort of establishing a comparative, right? And so like, I think the big issue, right, with a lot of gov advocacy is that they tell you, Judge, that like the problem in the status quo is that people are taking funds away from Medicare so that all the poor people who can't afford private care or who don't have a job that gives them employer-sponsored health insurance, right, don't get the health insurance they need. We say that the problem then is not that we don't have Medicare for all. The problem is that the Medicare we have that isn't single payer health care, that's just like subsidy, like basically welfare for poor people so they can afford healthcare, is not giving welfare to all poor people. Like this is like saying, like if food stamps didn't cover like half the poor people, that now because food stamps don't cover half the poor people, instead let's just provide free food to everyone. That doesn't make sense, right? It makes more sense to how about let's reform food stamps, make sure food stamps provide food to the people who can't afford food, and then let's make sure that like there isn't any monopolization over food production, which screws over the people who are individually buying food, right? That's what op advocacy basically says. Op advocacy says, let's stop this barrier, which is employer-sponsored health insurance, and creating competition to provide like cheaper health insurance and good quality health insurance for the average person. And let's also make sure Medicare, which functions as welfare basically to make sure poor people can afford healthcare, let's make sure Medicare actually gives healthcare to all the poor people who can't afford healthcare. We think that the comparative here isn't a world where everybody's insured and a world where some people aren't insured. We think both worlds have everybody insured. In our world, the people who cannot afford healthcare still are insured, right? And they cannot make any arguments about how we don't have enough funding because they necessarily are going to require more funding than us insofar as they like actually, right? They are actually providing health insurance to everybody and we're just making sure poor people get Medicare, right? And so they can't make this funding argument. So insofar as that is true, we actually make sure everybody is funded, everybody has healthcare in our world too. So the issue becomes who gives better quality, and that is something op wins on. So proud to oppose.
Thank you very much. Second go.
Okay. So I'm just gonna flow everything on one sheet because that's how I think that they did it. And then I'm gonna go to my advantage. All right. Okay, so today we strongly affirm the resolution. So let's just get right into it. So they basically say in the beginning of their speech in their overview that the reason that healthcare is increasing is because there's a lack of competition. But when we have isolated that the government is currently cutting Medicare costs and that there isn't as much like single payer or subsidy funded healthcare and prices are still rising, that still exists in the uniqueness. The reason Medicare existed in the first place because healthcare was increasing based off like increasing prices. So the reason the whole like business subsidy thing even existed in the first place is because people weren't able to afford their healthcare on their own. And that's why the government needed some way to make it so their civilians could. Go ahead.
Are you aware that the reason employer-sponsored health insurance exists is because during like the World War II, right, the government capped the amount of income you can give. So to hire people, they offered a health insurance instead. Like that is the reason it exists, not what you just said.
Okay, but what the general reasoning behind my argument is that healthcare, regardless of competition, healthcare prices are increasing. And so yeah, go ahead. On the counter plan. So their counter plan is basically to abolish the tax incentive for employer-based healthcare. But they make a fatal mistake here when they say that they are only expanding Medicare. Medicare is the government's insurance for disabled and older citizens, which means they don't solve for the healthcare coverage for millions of Americans who don't meet those requirements. So basically, when they don't expand healthcare, they are basically excluding all of the Americans in all of the statistics that my partner isolated in his first speech. Like Medicare isn't providing healthcare for those people in the current world. So why would they provide healthcare for those people in the world of the negation? Like, for example, these are the people that don't even have the jobs these are the people that aren't even working for companies which are paying for their healthcare. They just don't have healthcare in general. So when you aren't increasing Medicare, you basically just forsake all of these people, and all of these people do not have access to the healthcare that they have. I'll get to it if I have time. So on the solvency, so the overview of the solvency is they misconstrue the idea of competition here. Competition occurs between private businesses, profit-driven companies, not the government. So their first argument about how in single payer one consumer, it limits competition and price increases. Our response here is that the government is not a profit-driven entity. They have no incentive to increase the cost of healthcare because they do not want as much money out of the people here. So basically, healthcare prices are simply not going to increase under a Medicare for all plan. On the second argument they make about how employee-sponsored healthcare goes away without the tax incentive, our response here is that millions of Americans will no longer have healthcare because their employers will cut their benefits. But there is no alternative for them to turn to. The remaining private insurers are too expensive when you can cross-apply our statistics in the status quo about unaffordable prices for them to be able to buy these, to enroll in that healthcare. The government does not provide an option for most Americans to turn to. And when Americans aren't able to get any healthcare in the current status quo, you need an expanded Medicare for all plan to actually address those Americans. So like the overview to this argument is that this counterplan completely negates the certain sector of American people that just absolutely have no money to be able to afford healthcare because they need it for other things like food, clothing, and other like extreme essentials. So when you aren't increasing Medicare, you forsake all these people. It doesn't matter if the prices are going to lower because it's always going to be unaffordable for them. Even if you give them credence on the argument that competition will lower, competition has not lowered the prices, it's always been increasing, but they will still not be able to enroll in that healthcare because they're just in that dire state of the situation. So on their third solvency point about how it increases competition and private insurers and it decreases cost. Our refutation here is, how does this make sense? You are decreasing the number of competitors, which means there is less competition and prices will increase even more. In the short term, there will be a massive problem when millions of people suddenly don't have healthcare and the options for them to turn to are way too expensive to afford. You are forsaking the sector of people that my partner isolates in in his first speech, where he's talking about how these people are literally not going to healthcare because it's too expensive. It's a simple supply and demand. When demand for healthcare increases, the market price will also increase. So that is why the healthcare prices are at such a high level right now, and that is why the government needs to step in. So their first actual argument in support of the counterplan is that the quality of healthcare improves. So if you are going to be buying their competition argument about how it lowers prices, then why would the quality ever go up? They are trying to, all of these medical companies post their counterplan are trying to provide the cheapest healthcare possible. And in so doing that, they are forsaking the quality. So actually under our plan, the quality actually stays the same or is better than the quality after the counterplan, because competition, they're not lowering their prices for absolutely nothing. Don't let them win that argument. They're lowering their prices because they're lowering the quality so they can have as many customers as possible. So yeah, there you go. On to the first advantage. So on the first advantage, a lot of things I need to extend here. So the first extension is I'm going to extend the fact that there are a certain sector, again, this is really important. There's a certain sector of the population that just absolutely do not have the funds to buy healthcare. They aren't even under a condition where they talk about where the jobs are covering for their healthcare. They just simply do not have access to this healthcare at all. And because our plan gives Medicare for all, because our plan gives them free healthcare, that certain sector of the population is going to stop dying because they don't have the healthcare that they aren't going to healthcare services because they don't have as much money. So that uniqueness point is unique to the plan. It does not get solved by the counter plan in itself. But furthermore, you can cross-apply all my arguments about how their counterplan just simply doesn't cover like the entirety of this advantage. Like cross-apply how the main argument for a single payer healthcare system and how it works is because it cuts the administrative costs provided by the private sector. And this is billions and billions of dollars, as my partner has pointed out. So when the counterplan effectively leaves the private sector open, you aren't solving for this huge amount of money that our plan solves for. You are leaving the administrative costs. You are leaving all of the you are leaving the pharmaceutical pricing, the fee structures and service providers, the unnecessary services, the inefficiently delivered services, and the misprevention of opportunities. So basically, they don't solve for the cost there. And that is a key argument that the plan will go through and that the counterplan will go, that the counterplan doesn't solve. And because the plan is just simply better than the counterplan and it works better on an economical system, you're going to be preferring it over the counterplan. And for those reasons, vote affirmative.
Can everyone hear me?
Yep.
Yes. All right. We negate the resolution today for several reasons. So first I'm going to go into like our plan and what our opposition framework is, and then go back into the AF case and then neg. So first, like the reason why employer-sponsored health insurance is bad, right? Unlike what our opponents say, we recognize that the reason why employer-sponsored healthcare like really rose up was in like the 1940s when there was a wage cap on how much money you can pay like individual workers, right? So what happened is that businesses started offering employer-sponsored health insurance as like a way to get people to join their businesses and their companies, especially like people that were highly qualified. Now, over time, this has increased to the point where like every single business is doing it, insofar that like people no longer have the choice whether or not to like go buy their own healthcare or go do it by their businesses, because their business is taking away money directly from their salary so that they can put it into healthcare and also get tax breaks, which is why they do this specifically. And we say that like as we've provided in our like contextualization and also in our first contention, that the reason why like healthcare is bad right now is because these employers, they don't necessarily care about like getting the best healthcare. Rather, they care about like getting the minimum amount of healthcare possible so that their workers can be placated and still have the ability to get those tax returns, which is why we see that this lack of competition in the status quo is so detrimental. Now let's go into like whether or not we cover everyone, right? And I think the government side has kind of misconstrued what we said. Like, yes, my partner misspoke insofar as that he said Medicare rather than Medicaid, but I think we all knew what he was talking about insofar as that we gave contextualization that like we're going to cover the people that aren't able to get the healthcare. That insofar that he did say in his speech that like we need to reform government provided health insurance because not everyone that needs it is getting it. So that means that on both sides we get the same amount of coverage. And I think this is fair, right? I think it's unfair for the to like expect the opposition to say like, no, we don't care about these people, like poor people shouldn't get healthcare. That's not the argument we're making today. Rather, the arguments we are making is about the quality of the healthcare. And this is overall better in terms of like the round overall. So now let's go into like our opponent's contentions, right? So they claim at the top of their case that like by having this Medicare for All plan, that they're doing two things, right? That firstly, they claim that they're like saving a lot of administration money by like having the government pay for it. And then secondly, they claim that like pharmaceutical prices will go down. So let's look to their first point, right? Firstly, we state that like administrative costs are actually marginal in terms of like healthcare costs. Rather, what costs most is like the fact that like these insurance providers and these the business in between like pharmaceuticals, that's what's causing like a lot of money. And secondly, we think that like just because like the government is all of a sudden starting to like pay for everything doesn't necessarily mean that costs will go down. We know that like, for example, the government provides a lot of pensions to government workers, and you're going to have to hire a ton of people to be able to cover all this administrative costs, which is actually going to increase costs, if anything, on side government. Rather, on side opposition, what happens is that when you get rid of like employer-sponsored health insurance, individual people are going to have to choose which healthcare plans that they want to go to. And this is going to increase competition because what we recognize on side op is that people look at the quality and at the cost of health insurance when they choose it, right? I'm not going to be stupid and just choose the cheapest health insurance that's not going to cover my costs when I go to the dentist. I'm going to look at the fact that like there are two options that I have here. One is like lower cost and has like and doesn't give me dental insurance. The other one is slightly higher and does give it does also give me dental insurance. And the third one is super high and also gives me dental insurance, the same amount as the second one. So I'm obviously going to choose the second one because I'm smart. I'm going to value both quality and the cost. And that's what we are going to see in our side when we eliminate and provide competition. Then let's go into like their plan about like pharmaceuticals, right? They claim like all of a sudden pharmaceutical prices are going down. And I don't think like either side has like a large claim to this. Like I think both sides can claim that like the prices like of creating the pharmaceuticals are going to be relatively the same, especially when we consider like in the US, a lot of the medical advances and technology that comes with like making medicine comes from the US in the first place. And this oftentimes is really expensive. We have to acknowledge that on both sides because a lot of times these companies fail when making them, so they have to spend a lot of money in doing so. So neither side solves for that problem. Now let's go into their first contention, right? Their first contention is about healthcare coverage, and they talk about like how there's an inflation price in terms of healthcare, and healthcare is really bad overall. And we do agree that there's a problem in the status quo. The reason why people are being underinsured is because they are put in jobs where their employers choose the worst off option for healthcare, or they are losing their job or like in between two jobs. And during this time, they don't have health insurance, which is a really big problem that we see in the status quo. People are afraid to literally leave their jobs because they know that the healthcare of their entire family depends on whether or not they stay in that job. We think this is really bad because these people aren't able to like mobilize and choose jobs that are actually good for them. So like, yes, we agree that there's a lot of problems with healthcare, but the problem on the government side is that when you actually have Medicare for all, you decrease competition, which is something that we have provided straight into our first contention that our opponents have not really responded to, right? Like my partner mentioned, what happens when you have Medicare for all is that it's not necessarily that the providers are still going to be like public, right? The providers are still going to be private under their plan. So what does this mean? Over time, the government isn't necessarily going to spend money on like giving 7 different or even like 10 different providers money, right? The government is going to choose probably 1 or 2. And what is going to happen is that because they're only going to choose a few, it's going to decrease competition because you're having the same amount of healthcare for everyone, no matter who they are. And we don't think this is a good thing. Rather, on our side, what we say under our first contention is that like we're going to have more competition. Let's look at the responses to our contentions, right? They say to our first contention like that the government does not want like that much money, wants to provide like good healthcare, so it will be a good thing. So response to this is like, firstly, like we think that like because you're likely going to invest in less healthcare providers, it's going to overall increase costs because people individually don't have the chance to be able to choose, and it's going to increase costs because healthcare providers aren't being affected by competition. And secondly, we think that like it's going to be really negative because when we pass the government side, we're going to see a political backlash insofar that like especially Republicans or people on the right that are really opposed to like Medicare are going to create problems in which that it's going to be much more difficult to like pass legislation making sure that like the Medicare is actually beneficial to everyone. And thirdly, we think that like we still on our side we still have competition because instead of having the government choose, individuals choose under our side. So let's go into our second contention, right? And the only response that like side government gives to our side is that like quality doesn't increase when prices are lowered. And we don't think this is true because of the nature of how like a market economy works, right? When people have the ability to choose, when there is competition, prices go down because companies are competing for their consumers. They want to be able to have the most amount of profit, which means that they're going to have to provide the best plan possible for people to want to buy that. So in the end, let's look at to like overall. We think that like insofar as the government side had the only response that they gave to our coverage point is that like we misspoke, even though they knew what we were talking about. Insofar that we provide better healthcare, I strongly oppose. Thanks.
I'll just be weighing under the comparative. So we're ready?
You are muted.
I unmuted and then muted myself because I thought I was still muted, which is my bad. Okay. All right. You can hear me now, right? I'm good. All right. Start now. Okay, we have 3 real issues, right? We talk about quality of health insurance, we talk about quality of life, we talk about coverage, right? Let's start with coverage. I think coverage is sort of like where we actually both sides are like have the same impact, right? Like Judge, they tell you we don't have coverage because I accidentally said Medicare instead of Medicaid. I don't think that's actual response to our counter plan, right? They don't tell us why simply like adding some funding to Medicare so that all poor or Medicaid so that all poor people can afford get healthcare, or if they can't afford like private healthcare, is like not gonna provide the same coverage that they do. Insofar as like basically what we're saying is every person who can afford private healthcare can go buy it, and the people who can't will get Medicaid, right, or Medicare, or like whatever like healthcare subsidy they have. And when that is true, right, we provide the same exact coverage as them. They don't really give any other responses. Like they knew what we were talking about, and like if really their only response was misquoting, like basically taking advantage of me misspeaking, like I think like it's clear that they don't have a response to like our argument about us having equal coverage. Insofar as that is true, I think like the main debate comes down to like how like the different mechanisms to provide that healthcare to everybody, what is better at maintaining quality, right, and decreasing cost. That ends up becoming the debate, right? And so I think it's quite clear that we decrease costs on the government insofar as they are whatever like costs we're giving to the government to make sure Medicaid and Medicare cover like all the poor people who cannot afford, right, health insurance. They are increasing that to the total population, right? So like I think we're very clearly decreasing the cost on the government. But then they could argue, look, you're increasing the cost of the people, but that's also not true, right? That's also not true because now the wage that was being taken up, like the amount of the benefits that was being taken up by employer-sponsored health insurance is going to be replaced with like a normal wage, right? Because if, as I gave you in my LOC, right, the mechanism that you can't decrease the total benefits your employee receives because they're just going to leave your job. They're not going to stay hired. There's no like reason, especially when these companies are already paying money for the wages, right? They're going to decrease that. So in the end, you're not putting an increased cost on the individual either, because the money that was going towards employer-sponsored health insurance is now going towards their own choice of what health insurance they want, right? We give you a bunch of mechanisms for why cost is going to decrease, and they don't really respond to it, right? We tell you that there's going to be competition because people have to like now afford the healthcare. They don't respond to this, right? And so what they tell you, Judge, like, oh, on the short term, private health is going to be super high cost, people can't afford it. But keep in mind, in the short term, private health insurance is going to lose literally all of their consumers. And insofar as they literally lose all the employers who buy insurance from them, they're also going to be scrambling to get people to buy their insurance. And when that happens, they're going to be forced to decrease the cost that people actually buy it, right? And they don't respond to this mechanism either. They basically concede it. They ignore like the arguments I give in my LOC explaining why cost is going to decrease when competition happens through individuals. Insofar as that is true, we see cost decrease in our world, definitely. But here's the clash of like quality, right? And you have two mechanisms to get to quality. You have the quality of the healthcare, but also the quality of life of the individual now that they're freed from the burdens of employer-sponsored health insurance. Let's talk about quality of life first, right? Quality of health insurance first. Basically what we say, Judge, is look, the individual knows what type of health insurance they need. And in doing so, when they choose between different providers, they can pick the health insurance which best provides the things they need and also doesn't provide extra stuff that they don't want, right? Insofar as that is true, they can pick the health insurance which is best for them. In their world, their health insurance is not individualized per person. And the issue with that is you're always going to be losing quality wherever that overlap happens, where somebody needs some sort of health insurance, but the government-sponsored single-payer healthcare doesn't cover that, right? And in doing that, what we do is we guarantee quality insofar as people know what they need for health insurance and they can choose that. And this, again, they don't respond to this mechanism of people being able to choose what's best for them. And it's something, again, I bring up in my LOC, which is like a real problem with all of their kids. They just like ignore all of our mechanisms to getting these benefits. So then we talk about quality of life. My partner explains to you how employer-sponsored health insurance like dictates, right? Like what jobs you can take. By freeing this up, we opened up like job mobility, which therefore we don't get just benefits in the health insurance realm, but we also get them in terms of like people's ability to choose what jobs they work. We only get benefits, we don't lose coverage. So proud to oppose.
All right, the order is going to be a global overview of the debate. I'll talk about our advantage one and then the counterplan. This debate comes down to one question: who best decreases healthcare costs and expand coverage? Through a single-payer healthcare system, the affirmative offers a more direct and probable method of expanding coverage. The negation's one single argument against the plan is that prices would increase because competition would decrease. But this argument fails at the point where the negation fails to consider that the government is not a profit-driven entity that increases costs. There's no reason why a single-payer healthcare system would suddenly become affordable. In fact, a single-payer healthcare system means healthcare is guaranteed to all Americans. So let's go into the specifics of this debate. on Advantage 1, both teams agree that the cost of healthcare is increasing in the status quo. If we do nothing, people are unable to afford healthcare, people are going uninsured, which is leading to many problems. The question in this debate is who best solves for those problems. So let's take a look at what the affirmative does. Through a single-payer healthcare system, we tell you that by passing the Medicare for All Act, we're covering all medically necessary services. There's no copays or deductible, and ultimately, all of these things provide good coverage at a cost that is affordable for Americans. Moreover, a single-payer healthcare system would mean that all Americans have the right to healthcare, and if they need healthcare, the government will be able to provide for them, which means that we have a very probable way of increasing coverage there. But let's take a look at the counterplan. There's multiple flaws with the counterplan. All right, let's just go with the fact that they also expand Medicaid. But that still doesn't solve the problem because Medicaid only covers low-income people, which means that millions of Americans who are not low income, who are not disabled, who are not over 60, still won't have a public option for healthcare. And that's a major gap in the counterplan there because they're not expanding government provided healthcare to everyone. They're only implementing existing systems which are excluded to a select number of people. But the second flaw with the counterplan is, it just doesn't expand coverage for people. It relies on private insurers to provide more coverage, and that is a dangerous path to go down. So let's take a look into it. Their argument for the counterplan is that the counterplan would increase competition and thus decrease costs. Two responses here that go undercovered. First is that cutting out employee-sponsored healthcare would actually decrease competition because the number of healthcare providers are only the handful of private insurers. If their logic, or let's say like there are 1,000 healthcare providers, including all these employees, but once they cut out all these employee-sponsored healthcare systems, there's only the handful of big insurance companies. If their logic about competition is true, then the counterplan would actually decrease market competition by decreasing the number of suppliers, which means that price would actually increase. But the second response, you can just extend my partner's analysis, is that it's a simple supply and demand problem. Supply is remaining the same, but demand is increasing. So on a price versus quantity graph, that means the demand curve shifts to the right and the equilibrium price increases. I think my econ teacher would be proud. But let's go on to the next thing. They tell you that single-payer healthcare system would actually decrease competition, but they can only access arguments about competition in the private free market. The government is not a profit-driven entity; it's a public entity, which means that it can keep prices low and afford the loss of profit because the government doesn't care about profit there. Which means that all of their analysis about how our plan would actually increase price is false because the government doesn't rely on free market competition to determine the price that they set these services. So you can disregard that offense against the plan. So let's do some weighing at the end of this debate. And this is going to be key here. The biggest impact in today's debate is about healthcare coverage. Who is best able to expand coverage to millions of Americans? On probability, we are clearly winning. In order for the opposition to increase coverage, they have to assume that prices will somehow decrease and that people will be able to afford all these new prices. We have already shown how unlikely that is given that competition will decrease. But on the government side, our links are direct. A single-payer healthcare system means that the government will be able to provide coverage to everyone. It becomes a public service. If you need it, you'll be able to get it. So on probability of coverage, we're definitely winning there. But on magnitude, the negation will inevitably leave some people behind who just can't afford the private options. Once again, the probability that everyone will be able to magically afford healthcare is low. In fact, if we take a look at the trend of the status quo, there is competition right now, yet the price of healthcare continues to rise. The same thing would happen with the counterplanned world. The price of healthcare will continue to be inhibitory. People won't be able to afford it. So we're winning on magnitude. Finally, the last argument is about the quality of healthcare. We tell you in our plan that single-payer healthcare system gives the quality coverage that everyone needs. It covers all the medically necessary services and preventative care. Many people do not have the ability to choose because of how poor they are. Okay, so they tell you that people want to choose between quality and quantity and do the best, the quality and price and choose what's best for them. But many people don't have this ability to choose. They're simply too poor. Yeah. Only the plan is going to solve.
Can I just PO that last sentence?
I'm sorry, repeat that, please.
Can I PO the last line he said?
If I could respond to the POO, so basically you guys say that
he didn't say what he PO'd.
I haven't even made the PO.
But the last sentence. Okay.
But can I just explain what part?
Yes.
Basically that analysis of about how people can't choose any analysis the ability of people to choose healthcare that's good for them, right? And like the inability to do so is new because we said that in our LLC. So if it was just any of that content, like I'd
To
say
be
it's across.
totally honest, it's like overtime anyway.
All right.
Yeah.
So
I
that's
didn't, I didn't.
irrelevant because I stopped listening when the timer goes off.
Yeah.
So
All right. I guess we'll have a little deliberation. Okay.
yeah, if you guys want to submit your ballots, and then we can give RFDs. We're not deliberating though.
Right. Yes. Sorry.
Okay. I thought you said that, but I just want to be clear that we make independent decisions.
Yeah. Yeah. I got you.